Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, how the fight against COVID is preventing other illnesses too. But first, 2 critically ill COVID patients are saved by lung transplants. Before coming to the University of Maryland, John Miklas didn't think he would survive his COVID fight.
I asked him, what should I do? Is there anything I could do? And the doctor's recommendation there was to get my affairs in order.
Luckily, John was transferred to the University of Maryland, where he received a double lung transplant performed by a cross-disciplinary team led by Dr. Alexander Krupnik in the program in transplantation. Dr. Daniel Maloof is the program director.
In the case that patients that are in need of transplantation are those patients that initially, when they have COVID, the lungs are affected so badly that they will need to get the lungs exchanged.
Can you hold your arms out for me?
Anthony, who had a pre-existing lung condition before contracting COVID, also received a double lung transplant. He's thankful for his care team and for the donor's life-saving gift.
Words couldn't express the way I feel and how much I appreciate what whoever the donor is did for me.
The transplants were challenging because COVID infection is centered in the lungs, and doctors are still learning how COVID affects transplant outcomes.
We quickly realized that the virus affect people differently, and not every transplant patient is affected the same way that we expect. We have seen COVID across all organs, liver, lungs, kidney, and heart transplant patients, but especially in the lung transplant patient has been a challenge.
Sorry.
John is grateful for the second chance he's been given, thanks to the program in transplantation and the team of physicians, surgeons, and anesthesiologists who performed his transplant.
The team at University of Maryland transplant team is about 200 members. We have incredible, fantastic nursing. We have great coordinators in each organ's physicians from the medical side and surgical side. We have infectious disease, we have pharmacists, we have social workers, and we have also nutritionists that all of them do an excellent job and work very multidisciplinary fashion.
When I relive all this, it gets emotional, but luckily I got the opportunity for this. If it wasn't for this hospital, I probably, I wouldn't be here.
In our Discovery segment, researchers have found that public health measures designed to reduce the spread of COVID-19 may have a significant side benefit for those suffering from chronic obstructive pulmonary disease.
Rates of admission for COPD dropped by over half. And this was much greater reduction than we saw in other conditions such as heart failure, heart attack, and diabetes. And the reason that we think is driving this large reduction in COPD admissions is that the masking that we're wearing, the social distancing, and other interventions that were intended to control the spread of the COVID virus were actually extremely effective at controlling other viruses that spread during the wintertime. Flu, as well as the other viruses that we looked at, which included respiratory syncytial virus, parainfluenza, human metapneumovirus, some of the non-COVID coronaviruses, they were all virtually eliminated.
COPD is the 4th leading cause of death worldwide, and respiratory illnesses contribute to over half of COPD hospital admissions.
And it's a massive cost. The cost to the United States to take care of patients for COPD exacerbations is in excess of $30 billion a year.
Dr. Reed and co-author Dr. Jennifer So believe there's a silver lining to the behavior changes since COVID began.
Perhaps the most important thing to take away from our study is that even when we get out of the pandemic, there may be value to continuing to wear masks for the prevention of other conditions that are not related to COVID at all. If we want to do something moving forward that doesn't do some major disruption to our economy, but is simple and effective, easy masking is probably the way to go.
After a year of remote work, faculty and staff are finally transitioning back to the workplace. It's another positive signal that the pandemic is coming to an end and life is returning to normal.
I'm delighted to welcome everyone back to our campus. and our offices and our classrooms to begin our formal transition back to normal. I'm truly amazed at how much we have accomplished over these past many months under these extraordinary circumstances. However, I think we are so very happy and excited to begin these in-person interactions once again. Our primary goal is to have everyone be as safe as possible as we return in person. Please be sure to read the guidelines that we have circulated and which are posted on our website. Again, I extend my deepest appreciation to each of you for all that you have done throughout this period.
That's Frontline News. Thanks for joining us. We'll see you again in 2 weeks.